Hi, so my name is Ayo, the scribe nurse, and this is going to be a mini presentation on pharmacology study tips. So, pharmacology is one of the courses that many students complain and find hard. I did find it hard in my own time, and it took a lot for me to be able to finally get it. I think on my midterm I didn't do so well, but eventually when I got what exactly the instructors wanted me to know, it helped. So I know there are different approaches to studying for pharmacology, but the most important things that you will need to know is first your drug dosage calculations, and this is important because if you don't know how to calculate the dosage of medication that you should be giving, then you're going to be endangering the life of people. You're going to be endangering the life of people, and you're going to be putting their life at risk. So you basically have to know how to calculate that. And so for pediatric dosages, what do you need to know? For adult dosages, what should you be rounding it up to? So for pediatric dosages, if it is less than 1 ml, you round up to 2 decimal places. But if it's for adult, if it's more than 1 ml, to 1 decimal place. Same thing for adult dosages. And one trick is that if you think the dosage is too high, then it is suspicious. Your answer is probably wrong, because if you have a question, for example, that says the ordered over the available times the vehicle, which is the formula we always use in pharmacology. What has been ordered, this is what the doctor has ordered, this is what is available from the pharmacy. How many meals should you be given? If it is like 16 spoons, you should watch that answer. Why would anyone ask you to give 16 spoons of an oral medication to a patient? And if you have say 40 tablets, for example, for a single dose, that is really suspicious. So that should always guide your calculation. For example, like if it's really tricky, then that's probably not the answer. Then other things you should know for dosage calculations is that between your figure and your unit, which is the meals or the tabs, you should have a space. So you should not write 2 meals together. It should be 2 space then meals. Then if you're going to write 2 tabs, it should be 2 tablets, not tabs. No short forms are allowed. And if you're going to calculate what a dosage should be, your formula is going to be what has been ordered over what has been available times the vehicle. The vehicle is usually per meal. So if it says per meal, you're multiplying by 1 meal. If you say per 5 meal, let's say 100 milligrams per 5 meal. So it's going to be what has been ordered over 100 milligrams per 5 meal. I hope you find that very helpful. Then, so to the main pharmacology proper, now that you have known how to calculate your dosage and you want to start giving medications, what kind of medication are you giving? Many medications that we give for medicines for ailments in acute care, they belong to a particular family, and one of everyone's favorite is the prils and the olols. All the prils are the ACE inhibitors, and the beta blockers are the olols. The like metoprolol. Metoprolol is the one we commonly remember. Bisoprolol is also one of them, and timolol, which is an eye drop, is also a beta blocker. So lisinopril, for example, captopril, they are ACE inhibitors. Then we have the statins, which are angiotensin receptor blockers. All of this medication belong to families. So if a drug is in a particular family, if your medication is in a particular family, then they will have similar characteristics. So when you're going to be grouping medications, this is what you want to know. You want to know what are these drugs called. Are they called this? Are they called loop sparing diuretics? Do they have a similar name in their ending, or are they just grouped based on function? And then number 2, what do they do? Are they antihypertensives? Are they H2 receptor blockers? Are they anti-ulcers? Are they anti-infectives like the cephalosporins and all of that? So if that is what they do, how do they work? Where exactly in the body do they work? Do they work through the kidney? Do they reduce blood pressure by working in the kidney, or do they reduce blood pressure by dilating vessels, or do they reduce blood pressure by ensuring that one receptor blocker or something is not a hormone is not being produced or something? You just want to know how those work. Then after knowing that, who are the people who take these medications? We already said antihypertensives, for example. So who would take antihypertensives? People who have a high blood pressure. Now, not everyone takes a particular kind of high blood pressure. We have the basic, like some people will just take any one. But who are the people who take this particular one? And who are the people who should not take it? Because not everybody can take every medication, right? There are people who will not take it. So what are the people who should not take it? After that, what are the common side effects that we see? So when somebody says, I'm allergic to this drug because I always have this, you can tell them, no, that's a side effect. It is not an allergy. And so they know, right? A lot of people say they are allergic to furosemide, which is Lasix, but they are not allergic. They are merely reacting to it. Some people say, when I take Lasix, it makes me pee a lot. The reason why you pee a lot is because the furosemide is actually doing its job. So there goes that. And I wanted to mention, I don't want to wait until patient teaching to mention this. You can tell them, take it earlier in the day. If you take your medication earlier in the day, then it doesn't make you wake up at night to go pee so much. So after that, you now know what it does, who takes it, and the side effects. You want to know, does this have any food contraindications? So this medication, do I need to watch what I am giving my patients when I am giving them this medication? Can they take grape juice? Do they need to eat before or after or during this medication? Like, do they need to take it with food, before food or after food? Do I need to measure their blood sugar? In the cases of insulin, for example, do I want to know where their blood sugar is at? Do I want to give it before lunch, before breakfast, or after breakfast? When is insulin best given? You want to know basis, is it on a sliding scale? If the person is on a sliding scale, how many units, depending on the person's prescription and all of that. You also want to know that. And for insulin, it's one of the medications where you always have to know the onset, peak, and duration, because you're dealing with people who can be hypo or hyperglycemic. So you always want to know when the insulin starts to work, when it has gotten to its peak, and when it starts to reduce. So we know whether you want to give a snack or you want to give another dose of insulin. And after you know where it works and the kind of food contraindications, what do I teach these patients, the person who is going to be taking this medication? For ACE inhibitors, we are always worried about we always want them to know that, okay, if you have dry cough, it is an expected side effect of this medication. If somebody is taking an opioid like morphine, for example, you want to be watching them for respiratory depression. And if you actually want to carry out that assessment, even for all antihypertensives, you want to carry out an assessment. So another thing to always note, for any group of medication, what assessments need to be done when I'm going to be administering this medication. So for beta blockers, for example, before you give it, you want to know the person's BP. Say their BP is like 90/50 or 40, for example, and you still want to give them something that will further bring down their blood pressure. Or for furosemide, you want to know what their heart rate is, because if this is something that is going to make their heart rate even drop further, you always want to find out which assessments accompany a medication. So there are medications that you cannot give without carrying out certain assessments. Then you also want to teach the patients, like I was saying before, I remember the other point. You want to make sure that you're teaching them, what do they need to know about this medication? Is it going to affect their urine? Is it going to cause them to have dry mouth? If it causes them to have dry mouth, can they take hard candy to increase saliva production? Is it going to cause them to be dizzy, orthostatic hypotension? So you let them know that when they're standing up, they have to, like when they're changing positions, they have to like do it slowly, or else they become dizzy and they feel faint. You know, the pertinent things that the person who is on this medication should know. And trust me, although we say people should tailor this to the patient's ailments, like the reason why your patient is taking this medication, but the side effects are mostly always the same for you to watch for. So if somebody is taking a particular medication, you're almost always going to watch for same symptoms, like it doesn't really change from person to person. So you can always watch what the person is reacting to. And one thing I did not mention is, before everything, always identify your patient and make sure that they're the right person. Always make sure that they have no allergies. Always make sure that you have the right medication for them, and you have to identify them by 2 ID checks. You have to ask them their name and their date of birth. It's very important, so you don't give the medication, the wrong medication to the wrong person. In another video, I will be doing a series of medications and how to better study and understand them. So if you like this video and you think it made sense and you'd like to see more of this, please let me know, and thank you and all the best.